As a doctor, I always pay close attention to news of outbreaks. It's part of my job to stay informed about potential health threats that could impact my patients and the community at large. Every new piece of information can be crucial in understanding and combating these threats. Recently, reports emerged from China about a surge in cases of a respiratory illness caused by human metapneumovirus, or HMPV. This virus, while not new, has been causing an unusual number of infections, raising alarms among health professionals worldwide. The regions most affected are seeing a significant increase in hospital admissions, particularly among vulnerable populations such as the elderly and those with pre-existing conditions. This sparked concern and brought back memories of the early days of the COVID-19 pandemic. The eerie sight of empty streets and the widespread use of masks are stark reminders of the global crisis we faced not too long ago. The fear of another pandemic looms large and the world watches with bated breath. Many are wondering if this is a new threat. The uncertainty and lack of information can lead to anxiety and speculation. People are eager to know if HMPV could escalate into a situation similar to COVID-19 and what measures they should take to protect themselves and their loved ones. The situation in China is evolving. Hospitals are working tirelessly to manage the influx of patients, and healthcare workers are on the front lines, risking their own health to care for those affected. The medical community is closely monitoring the developments, sharing data, and collaborating to find effective treatments and containment strategies. We need to understand what HMPV is and how it spreads. Human metapneumovirus is a respiratory virus that can cause symptoms ranging from mild cold-like signs to severe respiratory issues. It spreads through respiratory droplets when an infected person coughs or sneezes, making it highly contagious, especially in crowded places. We also need to learn from our experiences with COVID-19. The pandemic taught us valuable lessons about the importance of early detection, rapid response, and the need for global cooperation. Vaccination drives, public health campaigns, and the development of antiviral treatments were crucial in managing the spread of COVID-19. This means taking precautions to protect ourselves and others. Simple measures like wearing masks, practicing good hand hygiene, and maintaining social distancing can significantly reduce the transmission of respiratory viruses. Public awareness and adherence to these practices are essential in preventing outbreaks. It also means relying on credible sources of information. In times of health crises, misinformation can spread rapidly, causing panic and confusion. Trusting information from reputable health organizations and experts ensures that we are well informed and can make decisions based on accurate data. This will help us navigate this new challenge effectively. By staying informed, taking preventive measures, and supporting our healthcare systems, we can face the threat of HMPV with resilience and preparedness. Together, we can mitigate the impact of this virus and protect our communities. Human metapneumovirus, or HMPV, is a respiratory virus. It was first discovered in 2001 and has since been recognized as a significant cause of respiratory illness worldwide. It's part of the same family as the viruses that cause measles and mumps, known as the Paramyxoviridae family. This family of viruses is known for causing a range of respiratory illnesses. HMPV is a common cause of respiratory infections, especially in young children. It is one of the leading causes of bronchiolitis and pneumonia in infants and young children, often resulting in hospitalizations. Symptoms of HMPV are similar to those of the common cold. These symptoms can range from mild to severe, depending on the individual's age and health condition. They include a runny nose, cough, sore throat, and fever. In some cases, individuals may also experience wheezing, difficulty breathing, and a decrease in appetite. In most cases, HMPV causes mild illness. Most people recover within a week or two without needing medical treatment. However, it can lead to more serious complications like pneumonia, especially in infants, older adults, and people with weakened immune systems. These groups are at higher risk and may require hospitalization and intensive care. The virus spreads through respiratory droplets. These droplets are tiny particles that are expelled into the air when an infected person talks, coughs, or sneezes. These droplets are released when an infected person coughs or sneezes. They can travel through the air and land on surfaces or be inhaled by people nearby. You can also get infected by touching a surface contaminated with the virus and then touching your nose or mouth. This is why good hygiene practices, such as regular hand washing and avoiding touching your face, are crucial in preventing the spread of HMPV. Preventative measures include frequent hand washing with soap and water, using hand sanitizer when soap is not available, and wearing masks in crowded places. These steps can help reduce the transmission of HMPV and protect vulnerable populations. If you or your child experience symptoms of HMPV, it is important to rest, stay hydrated, and seek medical advice if symptoms worsen or do not improve. Early detection and supportive care can make a significant difference in recovery. Researchers are continuously working on developing vaccines and treatments for HMPV. While there is currently no specific antiviral treatment or vaccine available, ongoing research brings hope for better prevention and management of this virus in the future. The recent surge in HMPV cases has drawn comparisons to the COVID-19 pandemic. Both viruses cause respiratory illnesses and can spread rapidly. However, there are important differences to keep in mind. HMPV is not a new virus like COVID-19 was. It has been circulating in the human population for decades. Also, while both viruses can cause serious illness, HMPV generally causes milder symptoms than COVID-19. Another key difference is that we have effective vaccines and treatments for COVID-19. Currently, there are no specific vaccines or antiviral treatments for HMPV. HMPV was first identified in 2001. Researchers in the Netherlands discovered the virus while investigating a cluster of respiratory illnesses in young children. However, studies suggest that HMPV has been circulating in humans for much longer, likely for centuries. Scientists have found antibodies to HMPV in blood samples from people born as far back as the 1950s. This indicates that the virus has been present in the population for at least that long. Despite its long history, HMPV remains relatively unknown to the general public. This is partly because it often causes mild illness and is not routinely tested for. Section 5. Protecting yourself and your loved ones' prevention strategies. In this section, we will explore various methods to safeguard your health and the health of those around you. While there is no vaccine for HMPV yet, there are steps you can take to protect yourself and your family. These steps are crucial in minimizing the risk of infection and ensuring that everyone stays healthy. These are similar to the measures we've learned to practice during the COVID-19 pandemic. The habits we developed during that time can be very effective in preventing the spread of HMPV as well. First, practice good hand hygiene. This is one of the most effective ways to prevent the spread of viruses. Wash your hands frequently with soap and water for at least 20 seconds. Make sure to scrub all parts of your hands, including the backs of your hands, between your fingers, and under your nails. Use an alcohol-based hand sanitizer if soap and water aren't available. Hand sanitizers with at least 60% alcohol can effectively kill many types of germs. Second, cover your coughs and sneezes with a tissue or your elbow. This helps to prevent the spread of droplets that may contain the virus. Avoid close contact with people who are sick. Keeping a safe distance from those who are ill can reduce your chances of catching the virus. If you are sick, stay home to prevent spreading the virus to others. Resting at home not only helps you recover faster but also protects others from getting infected. These simple steps can significantly reduce the spread of HMPV and other respiratory viruses. Additionally, regularly disinfecting commonly touched surfaces such as doorknobs, light switches, and countertops can further decrease the risk of transmission. Encourage everyone in your household to follow these practices. By working together, you can create a safer environment for everyone. In situations where social distancing is difficult, such as in crowded places, wearing a mask can provide an additional layer of protection. Masks help to reduce the spread of respiratory droplets which can carry the virus. Maintaining a healthy lifestyle is also important. Ensure you get plenty of sleep, eat a balanced diet, and stay hydrated. A strong immune system can better fight off infections. Regular physical activity can boost your immune system and improve your overall health. Even simple activities like walking can make a big difference. Finally, stay informed and consult with healthcare professionals if you have any concerns. They can provide you with the latest information and guidance on how to protect yourself and your loved ones. By following these prevention strategies, you can help to keep yourself and your loved ones safe from HMPV and other respiratory viruses. Together, we can create a healthier and safer community. Section 6. No cause for panic reassurance from global health authorities. The recent HMPV outbreak in China is concerning, but global health authorities are urging calm. The World Health Organization has stated that the situation is being closely monitored. They emphasize that HMPV is a known virus and that there is no evidence of increased severity or unusual transmission patterns. Similarly, the European Centre for Disease Prevention and Control has said that the risk to the general population in Europe remains low. They emphasize the importance of continued surveillance and monitoring of the virus. Section 7, Navigating the Uncertain, a call for vigilance and preparedness. While there is no need to panic, the recent HMPV outbreak is a reminder of the importance of vigilance and preparedness. We live in an interconnected world where infectious diseases can spread rapidly. It's essential to stay informed about potential health threats. We should also follow public health recommendations. This includes getting vaccinated against preventable diseases. Simple measures like washing our hands frequently and staying home when sick can go a long way in protecting ourselves and others. Section 8, The Power of Knowledge, Staying Informed in an Era of Emerging Infections. In today's world, where new health threats can emerge at any time, staying informed is crucial. We need to rely on credible sources of information. These include public health organizations like the WHO and the CDC. We should also be wary of misinformation that can spread quickly online. By staying informed, we can make informed decisions about our health and well-being. We can also help to stop the spread of fear and panic. Knowledge is power, especially when it comes to our health. Section 9, Conclusion, a shared responsibility for global health security. The recent HMPV outbreak in China is a reminder that infectious diseases remain a significant threat to global health. It highlights the importance of ongoing surveillance, research, and international collaboration. We all have a role to play in protecting ourselves and each other. By staying informed, practicing preventive measures, and supporting public health efforts, we can contribute to a healthier and safer world. The outbreak also underscores the need for continued investment in public health infrastructure and research. This will help us better prepare for and respond to future health challenges.